honored to have lead these discussions licensed attorney and professional fiduciary Darby Jones. Darby is a member of the Florida and Maryland Bar. She serves on the executive council of the Real Property Probate Trust Law section of the Florida Bar and is a registered professional guardian. Darby is also the founder and executive director of the Professional Fiduciary Council of Florida. Your health is the most important thing. It can sometimes be the most overwhelming. Darby, will you help us navigate all of this and not feel so overwhelmed?
I'm going to try, but it's interesting. I've heard that introduction so many times, and when you say the what ifs, well, today there are going to be a lot of what ifs, and I want you all to think about your own personal journey. Um, oh, thank you, Kay. Your own personal journey through aging. Um, and again, I'm so thrilled for y'all to be here. I'm excited about this episode. We are all getting old together. Okay, we're all aging together. We've not done it before. We're all new at this. So we're all learning together. I'm very grateful with your feedback and ideas for future episodes because I enjoy doing this and I want to definitely resonate with what you guys are curious about and how we might have meaningful conversations about it. My goal with any of these presentations is to provide thought-provoking, authentic, and meaningful information. I also want to say thank you again to AARP Florida for allowing us to do this broadcast and to reach all you wonderful people. So thank you, AARP, again for sponsoring this, and hopefully we'll be continuing this for years to come. As Chandra mentioned, former episodes are on YouTube and on the website. And I'm going to be referring to several of those today because we'd be here for hours if I had to go back and kind of highlight some of those issues. So pardon me, but I will be asking you to go back and look at or listen to, if you can, some previous episodes. And if you've listened to them, you're going to know exactly what I'm referring to. I also want to make sure that everybody out there knows I am not a doctor. I am not giving medical advice today or legal advice for that matter. I am just coming to you from having almost 20 plus years experience in dealing as a fiduciary for many, many people as a medical healthcare surrogate, as their agent under power of attorney, as their trustee, as their personal representative, as their guardian, as the executor, etc. So I have been in and around many, many medical situations, physical, social situations, which is really the impetus for this presentation today, to share with you my experiences and maybe some structure around why issues that we are all going to face, if not us, our loved ones, and that you are going to be better prepared to deal with the medical profession with some of these issues and to be prepared that they may be coming down the pike and what they are when they come. I also want to let you know that I'm going to be saying a lot of things, a lot of lists and a lot of recommendations. And unlike previous episodes, I have an outline. So if you want, you are welcome to go to the website, just went up in the chat at the end of this, and you can download the actual outline that I'm using to go through. So I don't have slides, but I just have an outline for you that you can print out and have for later. Okay, with that said, let's get started. We've got a lot to cover. I did mention that I was excited about this episode, and one of the reasons is from a personal standpoint, since I'm aging along with all of y'all. I'm also kind of interested in what's going to happen in our future. And I wanted to take a deeper dive into some of the clinical medical background and maybe the clinical issues about things that I anticipate happening to myself or others. So it was interesting. I was able to locate geriatric medical school lectures and listen to them, which was absolutely incredible. So I've been able to boil down a lot of those lectures into hopefully tidbits for us today. So good timing for you guys and myself. for getting more healthy and to be motivated. I hope I leave us all with some motivation to do some of the things that I know I've been ignoring and that I don't do myself. Um, so two things that kind of resonated with me, not necessarily from a medical standpoint, but just from a, mental get with it standpoint, was somebody said, think about how old you are today and think about how many summers you're going to have left. So based on myself today, I probably only have about 15, maybe less, good summers left. And that hit me like a ton of bricks. So I want you all to have that, hopefully that resonate with you, to say, you know what, I've spent most of my life ignoring fundamental things that I should be paying attention to. And if I want to thoroughly enjoy these summers, or even have more than 15 left, I need to start paying attention to things. The other thing that hit me like a ton of bricks was, what would your 90 or 95-year-old self be telling you today to change or to do? Very often we ask kids, what are you going to be when you grow up? What do you want to be when you grow up? Well, now we need to think about our older self asking us and telling us what we ought to be doing now to make our aging journey more pleasant, more confident, and hopefully a lot more fun. So we're going to talk about the many medical, physical, lifestyle conditions that can be misunderstood, misdiagnosed, or ignored by us or by the loved ones that we care for. What are the most common causes of death? What are the most common medical diagnoses? What are the most common reasons for doctor's visits? What are the most common reasons for ER visits? What are the most common conditions? What are the most common concerns of older adults? And we're going to go through all of that. And again, I want to end with a real kick in all of our butts to take better care of ourselves. Now, I'm speaking for myself. There are probably people out there that are much more um, uh, diligent about their medical care. But for those of us that aren't, let's try to use this date as motivation. Sadly, and this is a sad statistic, but sadly, of all the licensed physicians in the United States, less than 1% of those are specialized in geriatric medicine. It's amazing to me, considering that age and that population segment is growing and the need is increasing. But there are only 7,300 doctors in the United States that have a geriatric specialty. And based on our population, it should be over 30,000 geriatric physicians. So there is a very difficult to find a geriatric physician. I'm in St. Petersburg, Florida. And for those of you old enough, this used to be called Heaven's Waiting Room. So we have a very senior population here. And it is, I can name one geriatric physician that I'm familiar with here in Pinellas County, which is very sad, considering the nature of our population here. But why is that? Why is it so low? And sadly, it's probably a lot to do with economics. Geriatric medicine is probably not a highly remunerative kind of medicine. As you can imagine, dermatologists, plastic surgeons, orthopedics, they make a lot more money on their procedures and their activities than you do counseling geriatric medicine. So that, I think, has a lot to do with it. And it's also not as prestigious, of course, as it would be to say, you're a neurosurgeon. So sadly, I don't know how to change that situation, but that is the reality. So as a result, a lot of people who are being treated for geriatric issues are being treated by physicians that may not have a lot of the sensitivity or background that they need to assess and manage your geriatric issues. And we're going to talk about those. And hopefully what I'm going to share with you is going to help you in your consultations with I was going to say lawyers, consultation with the doctors, to help them understand the difference in your situation, because they may not have given it any thought. So one of the challenges with having a geriatric patient is the fact that we all have a much longer and possibly very complex medical history because we've been around longer. So we've been through a lot. So a lot of doctors don't take the time or think that there could be a lot of complicated issues that we've been through in the past however many decades we've been on this earth. And they assume often that any old person coming in is the same. It's just some old person, so it's going to be the same old situation. And I know that we can all, in our own world, we can know someone who's in their 90s who is super sharp and with it far more than someone that we know that's in their 60s or 70s. So not all old people are the same by a long shot, but the assumption and the perception is that we are. So responses to illnesses when we're older is going to be different. And again, that's because we have so much medical history inside our body, and not just physically, but mentally, that some conditions may have different symptoms and issues than a younger patient. So doctors really need to be aware of these issues and to be more patient and maybe be more understanding and inquisitive as to our history, medical history, and not get as frustrated maybe with older people as they tend to be sometimes. So what are the most common causes of death? Well, strokes and heart disease are the top. So so can't change that. That's the reality. TIAs versus strokes. I'm sure all of you all have heard of a TIA is like a mini stroke. The way to tell the difference between a TIA and a stroke, apparently, is that a TIA is a temporary interruption of the blood flow to the brain, and it resolves itself generally within 24 hours. So that's a TIA. Obviously, strokes do not resolve themselves within 24 hours. What are the most common medical diagnoses? Heart disease, number one. Now, in heart disease, we're going to talk about heart attacks. And heart attacks, I'm sure you all have probably heard that heart attack symptoms can be very different among individuals. And it is especially true for women and for people with diabetes. Their symptoms are very different. And compound that with the fact that you're older, that your symptoms again could have a variation. So for women and diabetics, the symptoms to look for are lower back pain, loss of bowels. I've never heard of that before. Fatigue, confusion, dizziness, and also that the EKG may not even show symptoms of a heart attack. So be very careful, any women out there, to not assume that the traditional symptoms of a heart attack apply to you. The next heart disease that we see very often is CHF, which is congestive heart failure. I'm sure probably many of you have heard that term. It sounds very scary, and it is, but it's not as scary as it sounds. It's really fluid that has accumulated around your heart. And that fluid is not just around your heart. That's probably the place it identifies the soonest. But that fluid also impacts your liver function and your stomach function. So when you are diagnosed with CHF, which some of you may, keep in mind that it impacts more than just your heart. There you go. Okay, thank you. And apparently a CPAP, one of those machines that you wear to help you breathe at night, is apparently a good thing to utilize. if you have any fears or if you have heart conditions that you want to maybe support or help. Another diagnosis is cancer. Of course, I'm not going to go into all the various kinds of cancer, but that is the second most common. Diabetes, arthritis, dementia, and we're going to talk about dementia a little bit later. High blood pressure. And again, it was interesting that the doctor suggested that to take blood pressure from various positions, from laying down, standing up, sitting, all of different positions to get a better and more accurate range of your blood pressure. Another diagnosis is high cholesterol. And then falls. Now we're all afraid of falling, and there's good reason to be afraid of falling. So what that means is, of course, typically is a hip or pelvic fracture. Surprisingly, in my experience, pelvic fractures are really a lot less traumatic. I know it's hard to believe, but a pelvic fracture is a lot less traumatic than a hip fracture. So again, it sounds like it would be a heck of a lot worse, but very often a pelvic fracture, there's no surgery possible because it's so contained that the fracture will heal itself. Not that that means it's nothing to worry about, obviously, but a hip fracture is going to take more medical procedures. So lack of mobility, you're going to hear me say this a lot today, is really a problem with all of us as we age. And the falls from a standing position are far worse than from a position where you had something to grab onto. For example, a cane or a walker or a piece of furniture or you slipped out of a chair. So if you fall from a standing position, of course, that's going to be a much more serious fall than a fall where you've maybe had someone holding your hand or you've been holding onto the rail of the stairs or grasping onto the door of the car, etc. So keep that in mind. So what can you do to help with some of these diagnoses? Well, moving, and that was a very serious theme through all of these lectures, is to keep moving. And movement for all of us is going to be different. Some of you out there are probably some super athletes, which is awesome, and more power to you. I tend to be pretty lazy, and I'm going to have to kind of get over that. This class is scaring me too, so I need to make an effort to move. I can't just rely on my parents' good genes anymore. I need to really make an effort to just physically move my body. We cannot prevent the issues with age, race, or sex. We can't change any of that. But what we can look at and prevent and help and look at is obesity, smoking, diabetic care, AFib, and sedentary lifestyle. Those are things we can, that are in your control to address and try to address. So what are the most common reasons to visit a doctor? Number one is flu and colds, very common. Again, that's why it's important, I think, for you all to pay attention to your vaccinations. And also, obviously, keep a clean lifestyle, which I think most of us, having gone through COVID, have sort of a better respect for just washing hands and being more cleanly. Falls, that's the next most common reason for visiting a doctor. We've just talked about falls. UTIs, super common, very common problem, and they can go undiagnosed very easily. So if you have someone or you're caring for someone that starts acting a little off and you're thinking, oh, it's dementia or Alzheimer's, whatever, it's not. It could very easily be a urinary tract infection, that's a UTI. And they become very, very common. And I think women tend to be more susceptible to UTIs than men, but men are not immune, of course. Pneumonia is the next most common. And this is comes very probably commonly for people who have been diagnosed with COPD. So be aware that if you've been diagnosed with COPD, that you may have an inclination to get pneumonia more easily than others. And that comes down to lung function, of course. We're going to talk about that a little bit later. So what to do? Well, again, lack of movement. Lacking movement is a risk of also developing blood clots. You know, you've heard of people sitting in a plane, or you're at the hospital and they put these massaging things on your legs, or people, you need to stand up and move around. It's because they're a fear of blood clots. And blood clots quite often end up in your lungs. And that there's no happy ending. So you need to be aware that not only is this sedentary lifestyle risky for your heart or for your mobility or for falls, but it's also for blood clots. It may also be an indication when you have edema. Edema is a sign of perhaps congestive heart failure or pulmonary embolism. So be aware of any signs of edema. Take it seriously. Okay, what are the most common reasons to visit an ER? Statistically, here we are. Drum roll, everybody guess. Falls. Falls are the number one reason for aging populations to end up in an ER. Falls are the leading cause of fatal and non-fatal injuries. The leading cause of brain uh, brain injuries and also brain bleeds. So falls are the leading cause of fatal and non-fatal injuries. And as a result, you can get brain injuries and brain bleeds. The next most common are car accidents. I thought this was surprising, but car accidents are the next. And the third one is the adverse effects of medications. And I can tell you that when I've had clients that go to the hospital, they are living at home, they have a whole array of medications, they end up in the hospital. At the hospital, those medications get all reevaluated and possibly changed and likely changed. They get discharged with a whole new regimen of prescriptions. They get home, then you've got all of this mixture of medicines. And it can be very confusing as to what you don't take any longer and what you should take going forward. So in fact, one of the most common causes of readmissions to hospital is mismanagement of medication. So keep that in mind and try to keep track of your prescriptions and medications, keep them updated. And if anything's ever changed, make sure before you leave the hospital, you have clear understanding of what is discontinued or has been changed versus just being so happy to get out of there that you run into the parking lot and leave. You got to pay attention to that discharge plan. Really, seriously, get the care plan in writing, get the prescriptions in writing before you walk out that door. Now, I'm going to refer to an episode here, a prior episode that I wish everybody go back and listen to called Mom Fell, Now What? And I go through a lot of detail there about hospital visits and how to manage a hospital stay for your best interest. So I think we might even have a link show up in the chat here. Oh, Judith, I don't have the outline on the website just yet. But let's put a link to Mom Fell episode as well. Okay, so what are the most common conditions? Okay, conditions are just things that we all may suffer from. It might be temporary, maybe permanent. Hearing loss. Okay, I can attest to you right now, I also have hearing loss. I don't hear very well out of my left side, so I'm always having to listen to people through my right ear. Again, I'm not paying attention to it, haven't done anything about it, but I'm going to. One of the things I learned was that hearing loss actually accelerates the symptoms of Alzheimer's. So those of us out there that are hard of hearing, even though I don't think I've missed much, honestly, I think it's smart for us to get our hearing aids or getting our hearing checked. Hearing aids have come a long way, finally. So I think there are a lot more options for hearing help than there used to be, finally. Cataracts, again, I'd be willing to guess a lot of people in the audience have had cataract surgery. I have had it. I've had it twice. It's a very scary surgery, but again, it's one of the most common medical conditions. Back and neck pain is another very common condition. And again, I think that could circle back to that mobility and movement. You know, we're very sedentary. We're very, that which causes you to sort of slump, hunch, which may ultimately give rise to back and neck pain. COPD is the next most common condition. Lungs have a normal, as we age, our lungs normally start losing function. There's no disease that causes it. It's just a normal function of aging. So as we age, we need to make an effort to take deep breaths. I mean, like purposely take really deep breaths. I remember hearing about this during COVID, about the deep breaths and the timing, the seconds that you should do it. So take that to heart and maybe on a regular basis, once a day or whenever, try to just be cognizant of really exercising your lungs and taking deep, deep breaths in and out. COPT also is a precursor to a lot of pneumonia type related conditions as well. Next most common is diabetes. Again, as I'm sure a lot of you are very familiar with diabetes, and neuropathy is a symptom for, you start feeling the numbness in your feet. So that's a treatable condition. Depression. I can understand why a lot of us may have episodes of depression, not just because of the aging, but a lot of other issues that are going on, either socially, politically, environmentally. So depression can be a very common condition. And dementia. Dementia is an umbrella term. It's generally irreversible. According to the lectures that I heard, if you can get, I'm assuming we're all over 40 years old, maybe not, but according to them, if you can get to a place where you can have your genes researched and tested, you can be tested for the gene that is a proclivity to Alzheimer's, and that then they can maybe take you to further testing for help in diverting your onset. But once you have Alzheimer's, my experience with my clients, the medications really don't help. My clients, they're 60s, 70s, 80s, 90s-year-olds. Many times the medications that are provided, the Aricept, the Namenda, almost cause more symptoms, appetite issues, nightmares, sleeping disorders, than it's worth having the medication. So the good news about Alzheimer's is it seems like there's a new article or a new thought coming out about Alzheimer's every week. So there is a lot of research being thrown at this issue. So pay attention to those articles. There may be something that resonates with you or your doctor. Again, your doctor is not a geriatrician. They're probably not paying as much attention to these issues. So you should, and when you go to the doctor, ask about it or share with them maybe some of the research that you've come across. Alzheimer's takes decades to develop. It doesn't just happen overnight. So our executive function can start deteriorating decades before someone might really think, oh, she may have Alzheimer's. I think we all can relate to that fear. But with that said, I've had a neurologist tell me one time, it was a cute story. Because when you start thinking, oh my God, I can't remember the name of my high school principal, or I can't remember where I put my keys, or oh gosh, I forgot all about an appointment. Oh my God, I must be getting Alzheimer's. Don't think like that, because the truth of the matter is, when we were 5 years old going first grade, we forgot our lunch money and we forgot to do our homework in junior high school, and we forgot. So we've been forgetting stuff. That's human nature. So don't panic if you're forgetting things. Don't get depressed about that. It's not necessarily a sign that you've got Alzheimer's. um, Delirium. Delirium is a subset of dementia. And I will tell you that this is a real thing. Delirium is a temporary situation. It happens often when an older client goes to the hospital or goes out of their routine, out of their setting. You've now taken them out and them, it could be to a relative's house, it could be to another family member's house, or it could be to the hospital, that their routine is now all topsy-turvy, and they can go into a state of delirium. And this is generally impacts people who are over 70. And that's another thing, that geriatricians, for example, when you have an old person going in the hospital, they're not going to recognize that this may be just an episode of delirium and may go down an incorrect path. So if you're the caregiver, or if you're the healthcare surrogate for someone who goes into the hospital and may act kind of out of sorts, don't jump the gun. Make sure, put that on your list of something to ask the doctor if this is just an episode of delirium. Um, okay, unique issues for geriatric people. And guess what? That's us. So, so here are some unique issues for us to be contemplating. As we age, and we're all aging, our brain shrinks. There's nothing we can do about that. It just shrinks. And what that does, it causes the stretching of the tissue from the skull to the brain to stretch. And that stretching of the tissue puts stress on the brain. And that stress can sometimes be the reason for a brain bleed, or the occurrence of a brain bleed from less than a traumatic hit. So just be aware that our brains are shrinking. So we need to take good care of our brains. We have dry eyes. I know that I certainly have that. We have skin sensitivity, touch, and becomes more sensitive to us. Our eyes change shape as we age. Our ability to identify color fades. We have light sensitivity, an inability to pick up light into our eyes, which is why we have such challenging night driving. It's harder for us to see at night. Loss of teeth or dental function. Our taste buds fade. Now, the loss of teeth and the fading of our taste buds is actually pretty serious, because what that leads to is our desire to eat lessens. And when we start not wanting to eat, can't taste it, we're not feeling it, we we can become malnourished. We lose weight. We become tired. We don't create enough saliva in our mouths, and we have weakened throat muscles. All of that can lead to a lot of bad things. It becomes a choking hazard, actually, as we get older. So we need to make sure that when we're eating, we are more careful with our chewing, the size of the bites, the swallowing water as we eat. Especially if we live alone, folks. You got to be choking is becoming the increased issues of choking seem to be out there, statistically increasing. It also creates GI issues when we're malnourished and not eating healthily. It creates obstructions in our intestines, impactions, which are not pleasant. GI bleeds, inflammation, infection. It may start causing acid reflux, diverticulitis, and the weakening of the anal muscles. So make sure if you're taking care of someone or you yourself, find yourself not as enthusiastic about eating like you used to, make sure you understand the repercussions of that and maybe make a little more effort, even though you might not be able to taste it. Try to make yourself continue to eat healthily and take care of your dental needs. Okay, we have I mentioned this, but we have a decreased sensitivity to pain and touch. Our skin becomes less sensitive, and this leads to skin breakdowns. This UTIs, I mentioned that before, urinary tract infections. That's part of the reason why they're so common, is because the skin is breaking down, and more susceptible to pressure sores, which is another name for bed sores. You can't feel hot and cold like you used to. You know how mom's house is always so hot? Because she's lost the sensitivity of weather, or when the air conditioner comes on, it's way too cold. So they're very sensitive. We are getting very sensitive to temperature. I remember my mother, man, it was a nightmare going over there as hot as blue blazes. But now I understand. See, rather than being annoyed with her today, I would be very understanding. So all of you out there, this is going to help you be more patient, more understanding with the loved ones you're taking care of, I hope. Now, if you're over 85, they say you need to be very careful about being out in the heat or in the cold, because your body, the ability for your body to regulate your internal temperature is not as good as it should be. And therefore, you are susceptible to hypo or hyperthermia very easily. So be careful when you're out there gardening or you're out there shoveling snow. You can't stay out in the heat or cold as much as you used to be. So just be aware of that. Okay, let's move on to surgery and trauma risks. We're not as healthy as we used to be, and you want to be as healthy as you can be when you're going into surgery, because our recovery period takes longer. It's harder to recover from laying in a bed for days at a time. There's also increased risk of anesthesia. I'm sure your doctors can talk to you about that. So try very hard. If you know you have a surgery coming up, knee replacement, whatever, try to be as healthy as you can before going into surgery. It's more difficult for older patients to manage trauma. Apparently, we go into shock slower, so our body is not reacting to the trauma as quickly as it ought to. We have limited reserves because our fat layer is thinner. Again, our skin is thinner. Our fat reserves are not as strong to help our body recover. We may have, again, remember that long history we have. We have a whole bunch of long history of all kinds of medical conditions that might make a recovery from a trauma event a lot more difficult. And our immune systems are weaker. Bones and breaks. Oh my God. Okay, here we go with the falls again. Our backs apparently stiffen as we age. They become more rigid. Our discs shrink. So compression fractures and slip discs become more common. Our skull is more fragile. So brain injuries become easier to happen. So what are the top concerns for the, not that any of these haven't been a top concern. We've got a pretty full plate of top concerns here, but what are the top concerns for the aging population? The cost of medical care, the cost of home care or assisted living or nursing homes. And again, I'm going to make a reference to an episode here that we've done called Don't Put Me in One of Those Places, where I kind of break down the costs, the pros and cons of aging in place versus going into a facility. Another thing we're afraid of is the cost of prescriptions, the fear of being scammed, the cost of insurance. Those are all top concerns for our population. And I'm sure the AARP is on these issues from a lobbyist standpoint. Lifestyle issues, alcohol, it reduces your liver function and then causes swelling and fluid, which then you remember the congestive heart failure. Also, it's a strong indicator of causing Alzheimer's and brain atrophy. So we got to restrict our alcohol use. Drugs and addictions, for obvious reasons, have an impact on our health and well-being. I'm going to talk a little bit about assisted livings here because the lectures I listened to, actually, to their credit, they talked a lot about dealing with assisted living. Now, there are some great assisted livings out there. I get it. And there really are. But there are a lot that are not so great. So when you're looking for a facility or if you're assessing whether to go into one or not, I'm hoping that this information will give you maybe some things to look at when you're visiting or some things to think about. Doctors say that when they get a call from an assisted living facility, it's one of the hardest calls they get because they are so understaffed. And the client is usually in an altered status, and it's hard to get accurate information from the staff because they're defensive and don't have the information available. So there's some serious pros and cons to going into a facility. The decline in emotional well-being happens. It's very common, and that's I guess a fancy word for saying depression. The promise of personalized care does not always match reality, and I can tell you that is very true. The cost may become prohibitable. The physical health declines faster in an institutional setting because there's an increase in cellulitis. You've got a risk of MRSA, staph infection, lice, skin infections, colds, flus, C. diff can be very common. And it also encourages, sadly, a very sedentary lifestyle. Nutrition is not monitored, and there's a loss of dignity and privacy that can be devastating. There's a sense of abandonment, and you're going to have skin breakdowns, which we have heard lead to UTIs, pressure sores, and poor hygiene. Those are just some of the issues that you might want to think about when you're coming to your wits' end about what to do with mom, or what to do with dad, or what to do with your loved one or yourself about whether assisted living is the right choice or not. Now, I'd be remiss, we only have a few minutes left, to not talk a little bit about elder abuse and neglect. Abuse is when something is actually done to someone. Someone is abusing someone. Whereas neglect is that person is not choosing to do something for that person. Both of them can be very dangerous. Victims are very reluctant and afraid to report abuse for a variety of reasons. The fear of retribution from the abuser, the guilt of it happening, the embarrassment, or worse, they have no one else. So they can't report it because where else are they going to go? Some abusers are the adult children of the abused. So you have to be aware that sometimes there's a real complex social network going on. And again, this was good information, I thought, for the doctors to be aware of. So if you're ever involved or suspicious of an abusive situation, I would highly recommend that you get a good doctor involved who's aware of these specific issues, who isn't going to just listen to whatever anybody says. And what you should look for is that the abuser will usually interrupt and not let the victim talk. There are usually repeated visits to the ER. You have to watch out for being called an accident prone. The abuser will say, oh, well, she's always been accident prone. She's always falling. Watch out for bruises and hidden places, pinch marks, bites, and burn marks. And signs of neglect really show up in hygiene and in their dental care, their dental status. So those are things, if for those of you out there who are caregivers, or maybe you have a friend next door that you know of, that you see these signs, hopefully this is a call to action and some tidbits to look for. So I'm getting to the end here. I know it's been a lot of material. So lastly, I want to talk a little bit about end of life. And again, I'm going to make a reference to demystifying estate planning here, an episode that I did. 90% of the people want to die at home, but only 20% ultimately have the blessing of being able to. And this is such a sad statistic. And it's a reality that is, I think, a result of a profit-driven healthcare system where you're going to be talked into giving mom yet another procedure, or being talked into coming in and let's try this other thing. And while they're trying to cure you and help you, there's also a motivation there to get you to come in and have yet another whatever it is. So part of what I want you all to take away, and I've said this in every episode, you have got to have someone named as your power of attorney and as your healthcare surrogate. And that person has got to know what your goals are, your personal feelings, and they need to be strong enough to say, no, no, it's time. Mom wants to be home. It's time. We're not going to go get teeth whitening at 95 years old. Okay, we don't need that. Some dermatological issues are kind of get a little hinky when you get into your 90s. And some of the injury from the biopsies are worse than the actual potential of cancer. So you got to be critical thinking, and you need to be strong if you're the power of attorney for someone or healthcare surrogate, and not be lulled into doing things that really may not be in your client's best interest, or what they have told you they don't want to do. I know it's hard. It is hard, but you've got to be strong. So hospice is a great service. It is a great, great service. Palliative care is a terrific service. Unfortunately, it's only generally available in hospitals, but they are a great service. Do never be hesitant to reach out, even if it's just for a consultation. And a DNR does not mean do not treat. Okay, a do not resuscitate doesn't mean you're not going to get treated for care. So again, I'm as guilty as probably a lot of you out there for not taking as good a care of myself as I should have. But now it's time. And take baby steps, move every day, even if that just means walking around your living room. Take deep breaths. Maybe every time you take a shower, take that opportunity to breathe in that warm, moist air, expand your lungs, stretch a little bit in the shower. Drink water every morning, because you've been laying in that bed all night and you're dried out, and your organs are dried out, and your tissues are dried out inside. The first thing they need is hydration. So first thing you do in the morning is not coffee, but a big glass of water. And go outside and get some sunshine every day, because vitamin D and calcium deficiencies are why these bones get more brittle than they should. And it's epidemic in the United States of people being vitamin D deficient. So simply going outside for 10 or 15 minutes a day, not only does that mean you've moved to get outside, which is great. And then I know this sounds silly, but eat a banana every day. Banana, if nothing else. A banana is a great source of a lot of great vitamins, potassium, etc. So with that said, my last corny thought is, if you can manage, or if your loved one can manage to go to the bathroom by yourself, dress yourself, and feed yourself, there's a good chance you're going to be able to age at home and stay home. So just bring it down to that very simple concept. I want to be able to get up and down off the toilet. I want to be able to dress myself. I want to be able to feed myself. And that is a head start. So I don't know if we've had any questions. It's been hard to keep track of that. But I also want to remind you, my next episode is also going to be pretty interesting. It's about 50 Shades of Gray Divorce. So it should be a pretty lively conversation. So I'm going to open it up to any questions that you may have. I hope this has been helpful to you. It certainly was helpful for me to put this together for you. And again, the outline will be available on the website if you want it. I know I covered a lot of lists. Um, and thank you all for being there. Thank you, AARP. Please fill out the survey. I'm going to let Amy or Chandra exit us out of here.
I didn't
One little thing,
understand what
Darby,
you
if you
said your next talk is. I didn't understand 50 Shades of what?
of a gray
50 Shades of
divorce,
Gray Divorce.
I'm
50
still not
shades of a, that's
understanding.
okay. 50 Shades of a Gray Divorce.
Okay, thank you.
You're welcome. So, and that will be, as we mentioned in the beginning, we meet on the third Thursday of every month. So that'll be on August 21st. And we will discuss the 50 Shades of a Gray Divorce. There's been lots of positive kudos in the chat. Two little things, Darby, I want you to touch on when we have our 5 minutes left. In all of your learning online, did you see, is there any test for dementia like the one for Alzheimer's?
Well,
Did you learn anything about that?
I think Alzheimer's and dementia. Alzheimer's is a type of dementia. So if you get that gene test, that is what you want to test, the genes. But as far as testing, there probably is. Very often people will say, "Oh, my mom's, acting crazy. I'm going to take her to a neurologist and get diagnosed." The truth is, I'm not sure what the diagnosis is going to do. I mean, it is what it is. The There are some great counselors on Facebook and TikTok and all that to help you working with someone with dementia because it's hard. It's hard to have that person asking the question or being combative, but there are definitely ways of handling it that can make you less frustrated and angry. So I highly recommend reaching out for help if you have a person with Alzheimer's or dementia in your life, because there are clearly ways of making it a lot more tolerable for you. Maybe we should have that as another episode too. Lots of
And
tricks.
yeah, Dan, good comment. Tai Chi, it's a great way to get your body moving. It's low impact. It's good for your mental health. Everyone, you can remember 2 words, Aging Academy, and that's where you go online to find all of the episodes that Darby's mentioned today. Help My Mom's Fallen, what demystifying estate planning, the what to do. Don't put me in one of those places. All of them, just remember agingacademy.com. On that website, there'll be links, all of the YouTubes. You can email Darby if you have a specific question and you need some insight. That's what she's here for and we're here for. So thank you all. There's lots of good comments here. Eye-opening for sure. I mean, I'm sitting there going, yes, I need to think about all these things as well. So thank you all again for attending today. Thank you, Darby, for your wisdom as always and for sharing that with us and helping us not be so scared about aging gracefully. Um,
Thank you.
as a reminder to all of you, you will receive an email survey later today. Please respond to that. AARP really likes to know how you feel about these programs and what's resonated with you. So we do look at them each month. Darby reads each one. So please share the responses in the survey. We'll see you next month, August 21st, 50 Shades of the Gray Divorce. Until then, you can find us on AARP and find other local events in your community on aarp.org. So have a wonderful rest of your day and thank you all.
Thank you all for your comments. I really appreciate it. Y'all take care.
Thank you. Have a great day.